The health insurers were at the White House today meeting with the Trump administration officials to discuss a key concern for the industry. The issue is whether the president will pull funding from companies that sell plans on the Affordable Care Act exchanges. And as Kayla Tausche reports from Washington, the problem could end up at the center of a potential government standoff.
As the government barrels toward an April 28th funding deadline, one hot-button issue is emerging as a potential deal breaker. So-called cost-sharing reductions, $7 billion paid by the federal government to help shoulder the cost of insuring lower-income Americans enrolled on the healthcare exchanges. Without a new deal on healthcare reform, the Trump administration may choose to stop making those payments after a May 22nd deadline set by a judge. Democrats want those subsidies included in next week's spending bill, otherwise risking a government shutdown. Here's Senator Chuck Schumer today.
We're working hard to get it in the bill, and we're very hopeful. Negotiations seem to be going quite well, and I'm very hopeful we can come to an agreement that everyone can be proud of.
That would take leverage away from the White House on wholesale health care reform. Last week, President Trump told the Wall Street Journal, quote, "Obamacare is dead next month if it doesn't get that money. What I think should happen and will happen is the Democrats will start calling me and negotiating." Today, insurers met with White House officials in search of some certainty, with days in some states and weeks in others before having to decide whether to participate in exchanges or how much to charge enrollees. Withholding payments to insurers could make participation expensive or force more insurers to withdraw completely. Some answers could come next week when lawmakers return from recess. For Nightly Business Report, I'm Kayla Tausche, Washington.